Have you ever wondered if high blood pressure is silently stealing your health and freedom? I'm Dr. Story, and for over 25 years, I've helped people like you keep their hearts healthy and ensure that every part of their body functions smoothly. Today, I'll share 3 surprising reasons why your blood pressure is rising, along with some crucial advice to help you protect your health. Stay with me for the sake of your heart, and so you can enjoy your later years with the freedom to move and eat, rather than being confined and helpless due to the complications of high blood pressure. My name is Dr. Story, and in my more than 25 years of practice, I've helped people understand their health in simple and honest ways. I've witnessed life's ups and downs, and I've seen how high blood pressure can lead to heart attacks and strokesto, dangerous conditions no one wants to face. So let's embark on this journey together and uncover the real causes behind your high blood pressure so that we can find better ways to safeguard your health. Now, without wasting any more time, I will dive into the 3 reasons that are causing your blood pressure to soar, with the third one truly shocking. Let's begin. The first reason: genetic factors. Have you ever wondered why some people, despite engaging in seemingly unhealthy behaviors like smoking, uncontrolled eating, and using stimulants, still have normal blood pressure? It's not that they're immune to everything. There's something deeper at play. This made me realize that one of the strongest factors affecting blood pressure is genetics. Think of your body as a garden. Some gardens are naturally fertile, with rich soil that helps plants grow strong and healthy. Others, however, may have rocky soil that makes it harder for plants to thrive. Your genes work much like that soil. Some people are born with naturally flexible, healthy arteries that can handle stress without raising blood pressure, while others might inherit arteries that are less forgiving. Imagine 2 friends who grow up in the same neighborhood. One of them might smoke cigarettes, eat fast food, and never exercise, but still enjoy a normal blood pressure because his genetic soil is just that rich and nurturing. The other friend might have been blessed with a healthier lifestyle, but still struggles with high blood pressure because her arteries are naturally less pliable. It's like losing a lottery that you never even bought a ticket for. This idea might be unsettling. You can't change your genes. And for those who find themselves struggling with high blood pressure at a young age, it might feel like you're fighting a battle that's already been decided. But here's the good news. Knowing this is just the first step. Once you understand that genetics plays a big role, you can focus on the factors that are within your control. The second reason: high blood sugar and lifestyle. Now that we've talked about the hand you were dealt with genetics, let's talk about the cards you can play: your lifestyle. The second major reason for high blood pressure is a combination of high blood sugar and the choices you make every day. Every day, your body reacts to the world around you. When you're stressed, whether it's because of work, relationships, or just the hustle and bustle of modern life, your brain sends signals to your adrenal glands. In response, these glands release cortisol, a hormone that helps you deal with stress. But here's the catch. When cortisol levels remain high for long periods, they cause your blood sugar to rise. And that's not all. Imagine your arteries as flexible pipes that allow blood to flow smoothly. When you eat a lot of processed foods or foods high in sugar, the extra glucose in your blood starts to damage the inner lining of these pipes. Over time, this damage makes the arteries stiff, much like a garden hose left out in the sun for too long. When the arteries become stiff, the heart has to work harder to pump blood through them, which leads to high blood pressure. It might sound simple, but the consequences are profound. A diet filled with sugary snacks and processed foods, combined with chronic stress, sets off a domino effect in your body. High blood sugar leads to damaged arteries, which in turn forces your heart to pump, harder raising your blood pressure even further. It's a vicious cycle that can eventually lead to type -2 diabetes, another serious health condition that brings along its own set of challenges. The old saying goes, if you eat a lot of food out of a box, you're going to end up in a box. It's a stark reminder that the food we choose to consume directly affects our health. In this modern world, where convenience often trumps quality, it's all too easy to fall into unhealthy eating habits. But if you take a moment to reflect on your lifestyle, you might notice that small changes can make a huge difference in how your body feels and functions. So, what should you do? The answer isn't as simple as choosing one fancy diet over another. Whether you're a vegan, vegetarian, or a follower of paleo, Atkins, or any other diet, the key is to avoid processed foods. Look for whole foods that nourish your body. And when life gets stressful, find ways to relax and unwind. Remember, your lifestyle is one of the few areas where you have real control over your health. The third reason, age. The third reason behind high blood pressure is something that shocks many people, age. Yes, as you grow older, your body naturally changes, and one of those changes is an increase in blood pressure. It might seem like common sense, but it's a reality that many choose to ignore. Picture yourself as a well-worn book. In your youth, the pages are crisp and vibrant. Over time, as the book is read and handled, the pages become a bit more fragile, the binding less tight. Your arteries work in a similar way. They start out flexible and strong, but as the years pass, they lose some of their elasticity. This natural aging process means that even if you've had a healthy lifestyle, your blood pressure may still creep up as you get older. It's unrealistic to expect that at 85 years old, your arteries will be just as supple as they were when you were a teenager. The truth is, aging is inevitable. And while you can take steps to slow down some of the damage, like maintaining a healthy diet and exercising regularly, you can't completely stop the clock. However, here's an important point. If you're young and you already have high blood pressure, that's a red flag. It means that your lifestyle might be accelerating the aging process of your arteries. In other words, the damage caused by poor choices in your 20s and 30s can lead to problems much earlier than they would naturally occur. The message here is both a warning and a call to action. While you cannot change your age, you can influence how gracefully you age. By adopting healthier habits early on, you give yourself a better chance of keeping your blood pressure in check as the years go by. It's not about trying to turn back time. It's about ensuring that your body ages as slowly and as healthily as possible. A story of hope in action. Let me take you back to a moment in my own journey. As a doctor, I once had a patient in his early 30s who was shocked to discover that his blood pressure was dangerously high. He had always thought that high blood pressure was a problem for older people. Like many others, he assumed that if he was careful with his diet and exercised a bit, he was safe. But his genetic makeup had other plans, and his lifestyle filled with stress and unhealthy eating only made things worse. We sat down and talked about the 3 key factors: genetics, lifestyle, and aging. At first, he felt defeated, thinking that his family history doomed him to a life of health problems. But then we focused on what he could control. He began to change his diet, cutting out most of the processed foods and sugary snacks. He started to manage his stress through meditation and regular exercise. And although he couldn't stop the aging process, he learned that by taking care of himself now, he could delay the damage and enjoy a better quality of life for many years to come. This patient's story is a powerful reminder that while some factors are beyond our control, many are not. You have the power to change your lifestyle and, in doing so, influence how your body ages. It's a journey that starts with a single step of decision to choose health over convenience, quality over quick fixes. The road ahead, taking control of your health. As you watch this story, I want you to remember that knowledge is power. Understanding why your blood pressure might be high is the first step toward taking control of your health. Genetics may have dealt you a difficult hand, but you're not powerless. Your lifestyle choices, what you eat, how you manage stress, and how you care for your body are yours to control. The next time you're tempted by a sugary snack or find yourself overwhelmed by stress, think back to this story. Remember that every choice you make can either protect your arteries or damage them further. And while you can't stop the inevitable process of aging, you can certainly influence how gently it touches you. I want to encourage you to take action today. Consider exploring new, healthier recipes. Find a stress relief technique that works for you, or even just take a few extra minutes each day to relax and breathe. Little by little, these changes can add up to big results. If you're curious to learn more about managing high blood pressure naturally, I've put together some links and recipes in the description below. You'll find easy-to-make drinks and a tasty smoothie recipe rich in nitrates natural compounds that help lower blood pressure. These simple additions to your diet might be just what you need to support your heart health. Wrapping up, a message to remember. In this story, we've unraveled the mystery of high blood pressure by looking at three main culprits: genetics, lifestyle, and age. I hope that by hearing this, you'll feel more informed and empowered to take charge of your health. Remember, even if you can't change your genetics or stop the aging process, you can always choose to lead a healthier, happier life. So, the next time you think about your health, ask yourself, what small change can I make today that might protect my heart tomorrow? Whether it's switching out a processed snack for a fresh fruit, or taking a moment to breathe when life gets too hectic, every decision counts. Thank you for sticking with me through this story. I'm excited to continue this journey with you. Keep watching, keep questioning, and most importantly, keep taking care of yourself. Your heart is worth it.